Have you ever wondered how some people make eating healthy, exercise, and managing stress look so easy? You can too. Welcome to Wellness Wisdom, where we uncover the secrets to lasting health and happiness and empower you to make wise health choices, see results, and create a healthy lifestyle for good. Join Camille Kennard, licensed social worker, certified health and wellness coach, a self-care specialist on the journey to explore how to make health and well-being possible for you. It's a health and wellness journey you can take together. Please welcome your host, Camille Kennard.
Welcome, everybody, to Wellness Wisdom today. It's March already, and we're looking at springtime and getting excited for what that means. I know for a lot of us, when we've been sitting inside, there's the seasonal effectiveness disorder sometimes during the winter that we're just don't feel good. And I know that sometimes spring can bring that new life for us and can get us excited about possibilities and hope. And today we're going to really talk about something specific to women. So you women out there, I want you to perk your ears up to listen about women's health, mental health, and how your transitions in life, menopause, just the different things you go through can affect your mental health. So we're going to really talk about, just education, and then also just helping you guys find ways to boost and help your mental health. So I'm really excited. I have Dr. Allyce Jones with me. Allyce, thanks for joining the podcast today.
Hi, thank you so much.
Allyce and I met through this wonderful networking group that we're a part of, Utah Leading Ladies. And she has a lot of amazing background in women's mental health. And I think that's something that we, everybody can learn from and understand a little bit better, is what affects our mental health as women. So I'm just going to tell you a little bit about Allyce. She's a psychiatric mental health nurse practitioner, and she specializes in women's mental health. She received her Doctor of Nursing Practice from the University of Utah, and she completed a postgraduate fellowship in women's mental health at Case Western Reserve University School of Medicine, and that's in Cleveland. She is especially interested in treating women during reproductive transitions, including mental health symptoms during premenstrually, in pregnancy, postpartum, and during perimenopause. So this is going to be exciting because, girls out there that are about to get their periods, or women that are going through menopause, everybody can kind of listen to this and learn something. She owns Felicity Women's Center in South Jordan, and she offers psychiatric diagnostic exams, medication management, and brief psychotherapy for women throughout Utah and Wyoming. And she also does telehealth. So I'm really excited, Allyce, to talk about what you're doing to benefit women out there. And I would love for you to just kind of start out and tell us a little bit about your journey. I know it sounds like you kind of wanted to go into nursing, and then what got you interested in kind of specializing in helping women and women's health?
Yeah, so I wanted to be a nurse from the time I was 5 years old, watching ER, the TV show.
Oh, yeah.
So I started my nursing journey, and I figured I would just go to school until things worked out with getting married and having a family. So I ended up going to school till I got my doctorate. While I was working as a nurse, I worked in a variety of settings, but I did work with a lot of women, and I did see some gaps in care, specifically in care around pregnancy and postpartum. A lot of providers didn't know what to tell women about how to treat their mental health symptoms in pregnancy and postpartum. And it just seems like such a high stakes time that people should be really motivated to help these women and give them all of the information that they need to make an informed decision for their family. So I thought that I could do it better than what was happening here, but I knew I needed more education. So that's why I ended up doing the fellowship in Cleveland. And then
Awesome.
I came back to Utah to start my clinic.
So tell me, so you kind of saw that there was this gap that women weren't getting the specialized help when they were going through these transitions in pregnancy and menopause and that. What was was there anything that as you were learning about this that was eye-opening to you, or that really connected to you about women's mental health when you were learning about these transitions that we go through?
I was surprised how many of my friends had experienced it, and I didn't know because I was working as a psych nurse, and these were some of my great friends, and I had no idea until after it was resolved, and I just felt wow, there's like not a lot of people talking about it. There's not a lot of resources. So why talk about it if you're not going to be able to find help anyways? So I
So
that gap for my friends, sisters, cousins, anyone.
So it was kind of like a taboo subject or something that people didn't think they could talk about because they didn't think there was anything you could do about it or any help you could get for it. Do you have, so I know this is kind of a personal question, but is there something that happened with your own mental health that you kind of wanted to go into mental health? Because I mean, nursing is very wide, right? You could work in a hospital, you could work with babies. What kind of got you focused in on more the mental health side?
So like I grew up watching ER and I was like, oh my gosh, I would love like working in trauma, but I actually hate being around sick people. So I hated like being around sick people on the med surg unit or like in a bunch of my different nursing clinicals. So I was like, if I work in psych, like the people aren't sick medically, so I don't have to worry about them like throwing up on me or a bunch of different things. So I ended up mainly working in public health, which is like pretty safe, and then mental health. So I didn't have to deal with.
It's kind of like knowing what you like and what you don't like, right? I know I've worked in healthcare for a lot of years as a mental health therapist. And, you know, if I had a client come to me and say, oh, this is what's going on with my digestive system or my bowels, or I say, oh, talk to your nurse about that. I'm here to talk to you about, are you feeling depressed? Are you feeling suicidal? You know, so we have different comfort levels with different things. Some people wouldn't want to talk to people about their mental health. So I love that that's kind of something that you felt led to and was exciting to you. Because I think it's so important. I mean, I see a lot of teenage girls. That's a lot of my clients, as well as women in life transitions, maybe that are going through menopause or, you know, retiring, that time of life. So I think what you're doing is really important for women to recognize that these transitions there can be changes in our physical as well as our mental health that impact each other. So I love that you kind of talked about that and and your own experience with like, I want to just help people with the mental part. So I'm going to take a little quick break, but when we get back, I want to delve a little more deeply into looking at, let's go through the lifespan, right? From puberty to menopause and kind of each of those aspects of how it's affecting our mental health when we're going through those physical transitions.
Do you feel stressed, overweight, and unhappy? Are you tired of setting goals that you don't accomplish? Do you want more energy, motivation, and focus to create your dreams? Many people struggle to keep up the commitment, motivation, and confidence to be successful, to reach their goals and aspirations. They often let other things get in the way of their personal health and happiness. It doesn't have to be this way. You can change. Join us for a 6-week online health transformation workshop. Learn about the mind-body connection, overcome obstacles to health, create daily health rituals, get support from others like you, and change your life for good. Register now at flourishwellnessconsulting.com under online group workshops or email Camille at flourishwellnessconsulting.com. Our gift to you as a podcast listener is $50 off the transformation workshop. Use the promo code podcast50 when you register. This year, make peace with your body and like who you are for good.
Welcome back, everybody, to Wellness Wisdom. I'm having a conversation today with Allyce Jones. She's a doctor, a nurse practitioner that works with mental health, specifically for women. You guys, this is exciting that we have some support this way for women. And as we've been talking this month about like things that we can do to improve our lives, I want you guys to really listen in on this one because I think it's really important for women. Sometimes we think that we struggle with our moodiness or our, you know, the challenges of just mood for women. And it can be something that we feel negative about. Allyce, I know we talked a little bit about like what throughout the lifespan, you know, goes on for women. And I remember talking to you when we went to lunch and you saying, you know, it's normal for these hormones to change. And then that impacts our mental health, right? Our mood and how we're feeling. I would love for you to kind of talk with, you know, a little bit about like the teenagers out there when we're going through puberty. What kinds of things do we see for changes with our mental health when a girl's going through puberty?
So we know that before puberty, so girls and boys have equal rates of mental health problems. And then as soon as girls go through puberty, they have double the rates of depression. So that's one of the main hallmarks you would see. But the hormones do impact us a lot. Like that's what's causing the breast development, hair changes, sweating, body odor, oily skin. There's just so many changes that are impacting us physically, also emotionally, a lot of crying, sadness, maybe increased depression or anxiety. This is usually when people start getting mental health care, especially girls, is after they go through puberty. So we're also having, like with menstruation, the cyclical monthly changes that can impact a lot of people as well.
You know what, as you're talking about this, I'm thinking specifically of some of my clients, because I mean, for a long time I've worked with, children, but I have a lot of teen clients in my practice right now. And, they might be coming in and their parents are saying, oh, they're crying for no reason, just at the drop of a hat, they're crying, or, something happens where at school and they just can't get over it and they're just feeling depressed or anxious. And it sounds like what you're saying is this is a hormonal change for us. And when we have those hormonal changes, it affects the mood and our mental health. Can you talk a little bit more about that? Like how, I know you said like the hormones, when we're developing, going through puberty and all of that, those hormones are changing. So just having our hormones changing can affect our mood, right? And the way we feel.
Yeah, our appetite, a lot of things. And it's not that like the hormonal changes in people with depression or anxiety are abnormal. It's thought that the brains of the people are just more sensitive to these normal, natural hormonal fluctuations. So that's one reason there's no reason to like test hormone levels usually in a teenager, because it's just a normal, natural hormonal fluctuation that your brain is more sensitive to.
Wow, that makes a lot of sense. So, maybe someone that doesn't struggle with anxiety or depression might not have that intensity of the fluctuations, but because our hormones and everything are changing, our brains are sensitive to feeling more anxiety or depression or some of these things. Mm-hmm. Yeah, I think that's really interesting. And maybe it's for a lot of those teenage girls and their moms out there that are listening to this, it's kind of normalizing that those hormonal changes can really impact your mood. And it's not that someone's trying to be moody or difficult or irritable. It's that physiologically, in their body, things are changing, and that's affecting that. So, anything, yeah.
So like 85% of women report at least one premenstrual symptom. So that could be like the like physical symptoms like breast tenderness, bloating, changes in your appetite, like food cravings, headaches. A lot of people get fatigued. But then there's also like the mental health problems that come along with it: irritability, crying, anxiety, changes in concentration. So 85% of women report one symptom. To have PMS, you have to have multiple symptoms and they have to impact your daily life. So about 12% of women meet criteria for PMS. And then there's also something additionally called premenstrual dysphoric disorder, which about 5% of people meet criteria for. But that's when you have multiple symptoms of PMS, the symptoms that we talked about, and they are seriously impacting your daily life, relationships, occupational functioning, social functioning.
Yeah. So there's kind of like they always, I guess in the society, it's kind of like, oh, she's got PMS, right? Which we put it on, oh, if she's irritable or moody or whatever, it's a PMS thing. But I think that's too often kind of downplayed, because really it is a real thing that when you have that bloating and your appetite changes and you have fatigue, I mean, for any of us, if you have a cold or you have the flu, it's going to affect your mental health, right? If you're physically not feeling well, that's going to affect your mental health. I'm just wondering if you have some specific people that you've worked with in this, maybe stage of life, either through puberty or issues with their menstruation when they are, have had their period, and kind of a little bit of what you've seen with that. Like, how do you help someone who's struggling with some mental health issues at this stage, at that transition time?
So one of the most important things is tracking, because a lot of people have mental health symptoms scattered throughout the month. So I use a specific tracking form that has them track multiple symptoms throughout the month, and then also track their menstrual bleeding. So we know for sure if their symptoms are related to premenstrual or PMDD, or if they have symptoms variably throughout the month, just depending on what else is going on in their life. So I think tracking is the most important thing. Like, all women should be tracking their menstrual cycles, knowing how long they are, how long they're lasting. If you have PMS symptoms, there's lots of apps that allow you to track your PMS symptoms too, hours of sleep, how bad your cramps are. So I think just tracking is one of the best ways. And then if you are having symptoms, come see someone, because for premenstrual dysphoric disorder, we actually can't diagnose it unless we have 2 months of prospective charting. So I can't diagnose anyone with premenstrual dysphoric disorder the first time I meet with them. I have to meet with them, then give them tracking sheets for 2 months, and then meet with them again and make sure that the symptoms are in line with PMDD. And like, we have menstrual periods throughout like our reproductive lifespan, so like till our mid-50s. So you can have PMS and PMDD at different times of your life. So it's not like, oh, I didn't have it when I was 14 when I got my period, then I'll never have it. A lot of women start getting PMDD symptoms in their 40s when they're entering into perimenopause and the menopause transition. So it's not like, oh, I've had a bunch of periods and I've never had any symptoms. You just always have to be aware.
Yeah, I love that idea of like really recognizing what's happening. I love how there's so many apps now. I know I have one that tracks my period for me, and I love that, because I think for so many women, it's we're not, sometimes we're not in tune with what's happening in our body, or we're not keeping track of it. And I love that, because you can kind of see if there's like something that's happening regularly, like if there's a pattern there, right? I noticed for myself that every other month my period was more cramps than, so I was kind of noticing that. And I think for people to also kind of notice what's going on with their mood, like if there's a cycle to that, right, with their period as well. I think that's super interesting. And for them to be able to get the support that they need to kind of figure out what to do with it. I know you and I talked about, of course you're a nurse and you can prescribe medication, but also you're doing some like helping people with just behavior and how to change the way they see things, and that. If you have a younger person or someone who just started having their period come into you, and they're having some of this, maybe fatigue, but also, just really depressive symptoms kind of a thing, what kinds of things do you have them work on, or how do you help them with that?
So aerobic exercise is something that's really good for PMS and PMDD, and it's hard to do when you're like not feeling great, to be like,
Yeah.
oh, go to the gym and work out. There's supplements we can talk about. Taking a multivitamin, avoiding caffeine, which is actually a trigger for a lot of people during like the PMS, PMDD stage, not eating too many carbohydrates. Yeah, there's a lot of things that you can do besides medication, but there's also medication that you can just take depending on your cycle. So a lot of people, I'll just start on medications and put them on medication starting on the day of ovulation until the first day of their menstrual cycle. So they're not on medication all of the time, just during the time to prevent the symptoms, and then during the time they would be the most symptomatic. So
I love that. There's a lot of different things you can try, like supplements and caffeine. And I think sometimes when we're having our period, we think, oh, I want to eat lots of carbs and chocolate. And, and that it might feel good for the moment, but it might not really benefit us in the long term and it's interesting because I've always noticed that when I work out, when I'm having those, you're not feeling so great during your period, I actually feel better afterwards. I know it's really hard to get ourselves wanting to do it because you feel bloated and you're fatigued and all of that. But I love that. I think aerobic exercise really can impact your brain and it sounds like your hormones too, right? As far as that goes. So what kind of medication do you put people on? I know you do things to kind of help regulate their hormones and, putting them on depression or, antidepressants or things like that. Tell us a little bit about that.
So most commonly they use intermittent dosing of a SSRI. So examples of SSRIs are like Prozac, Zoloft, Lexapro. You can also use a hormonal form of birth control that prevents ovulation, because if you're not ovulating, then you're not having these hormonal fluctuations. So in theory, you shouldn't be getting PMDD or PMS symptoms.
Okay. And so the hormonal control, you can take some medicine for that. Also, you can be taking medication for your mental health, right? SSRIs, which are, antidepressants and anxiety, and Zoloft and Lexapro and that. And you said that you could just take it for like a short time period, right? While you're on your period or during that time.
Which a lot of people like that. If they're not having symptoms throughout the month, they only want to take something when it's actually going to be helping them. So a lot of people are more open to taking medications a couple weeks of the month than every day of the year.
Yeah, I think that makes a lot of sense for, because it's hard for people to think about, taking a pill for the rest of their life. And some people do need to do that. I mean, our body chemistry is all different. So you can take some hormones or, get hormone treatment. And then the SSRIs, do they work differently with the hormones, or is that just kind of the same? I mean, I've worked a lot with SSRIs because I'm a mental health therapist, but I don't prescribe, of course, but I'm just curious how that works with the hormones.
Yeah. So it's actually a novel mechanism of action. So we're not actually targeting serotonin. We're targeting how the SSRIs work on progesterone. And so usually if you start on an SSRI, they'll tell you it takes like 4 to 6 weeks to be effective. But if you're taking an SSRI for PMDD, a lot of people experience symptom relief or decreased symptoms the first day that they start taking the medication, which shows us that it is a different mechanism of action that we're using. We often use lower doses of the SSRIs as well.
So it can, in the first day, they can start to notice a change.
Yeah.
Okay. And it's affecting the progesterone that way.
Yeah, like the progesterone pathway.
Okay, cool. That's awesome. So can you tell me, like, PMDD, can that be diagnosed at any stage for a woman? Could it be diagnosed as in a young person as well as, you said you could have those symptoms at any stage, right? So do you see that in teenagers at all?
I don't treat teenagers, but I'm sure it can. But it is more common the older that you get. But it also makes sense because you have a lot more stressors the older that you get.
Yeah. And stress is impacting those hormones, isn't it? I know I see that with my clients, that serotonin and all of that. Yeah. So I would love for you to chat with us a little bit more about the people that you generally work with, and tell me a little bit about, is it women that are going through menopause? Is it women that are, in those reproductive years and wanting to have children? who do you usually see?
Right. I have a pretty broad range of patients. So I do see a lot of people for preconception counseling. So maybe if they had depression or anxiety in high school or college and they started on medications and they're doing really great, but they're planning to start a family and they don't know if they should stay on the medications, if they should stop the medications. It's always a good idea to have a plan before you get pregnant about what you would do with your medications if you do find out that you're pregnant. So I see a lot of people for that. I treat a lot of people in pregnancy and postpartum. A lot of people are reluctant to treat people in pregnancy unless they react to like the 1 or 2 antidepressants that a lot of people feel comfortable prescribing. So if they're one of the people who has tried those medications or another medication works well for them, then I'm happy to see them, or people with bipolar disorder or more severe mental health issues that can have a lot of exacerbations in pregnancy and postpartum. I see a lot of lactating moms who want to talk about medications and the risk for transmission in breast milk. I also see a lot of moms who want to prevent postpartum depression. So maybe they have a lot of risk factors, family members, a history of depression and anxiety. So they just want to come up with a comprehensive treatment plan to try to prevent it. And then hopefully we can keep the symptoms from getting worse or starting. And if not, then they're already connected with me so I can start their treatment pretty quickly and help them get well. And then I see people with depression and anxiety throughout the lifespan. And then I also have the perimenopause specialty. So I see a lot of women in their 40s and early 50s while they're transitioning.
Cool. So I think that a lot of people, when they're maybe they've struggled with some mental health issues, or even it's just the changes in the hormones when they're pregnant, I think a lot of people are nervous about, trying any medication or anything because of, the safety for the baby and things like that. Do you have a specific situation that you worked with this, or like how you usually help people with that? I mean, it sounds like you can take medication. There is some medications that are safe during pregnancy. Can you talk a little bit about that?
So I usually talk with the woman and her partner, if applicable, about the risks of not treating the disease versus the risks of the medication versus the the benefits of treating it for the mom and the baby. So there's no such thing as a non-exposure. So it's not like, oh, I'm depressed in pregnancy, but I'm not taking medication, so my baby isn't getting exposed. No, your baby is getting exposed to depression that's not treated in pregnancy, which also has risk factors that have been studied. And we know what depression looks like, what untreated depression looks like in a baby. We know what untreated maternal depression looks like when kids are 3 to 5 years old and going to school. So a lot of moms think like, oh, I'm not taking medication, so I'm helping my baby, but that's not always true. So if you don't want to take medication to treat your symptoms, there's a lot of other treatments that we can use. So we would just want to use every treatment that we can to help with exposures. But I have one example of a patient that I've been treating for prevention. So she had a history of postpartum depression with multiple other children, and she wanted to see me right after she delivered. She was not having any depression or anxiety symptoms yet, and her family was really on board with helping her. So we created pretty much a postpartum depression prevention plan. It had like 20 different items, including information about diet, sleep, exercise, bright light therapy, like a sleep contingency plan. So if she doesn't get enough sleep during the day, she has babysitters lined up to help with childcare the next day, because sleep is so important in the postpartum. And then I just monitor her every month to make sure her symptoms aren't getting worse. But so she does not have depression or anxiety at this time. We're still monitoring her, but it's been a few months longer than when her symptoms would usually be starting. So I think that's a great success case. It's a good reason to seek treatment even if you don't have symptoms yet. And that's one reason I don't bill insurance directly, is because I treat people who don't necessarily have mental health problems yet. It's just for prevention, which a lot of insurances will not cover unless you have an actual diagnosis.
I love this, because this is all what I'm all about is let's try to prevent things and make a plan and focus on wellness, right? Well-being. I think all of those things are so important. And if you have a plan of what you're going to do physically, mentally, socially, right? Getting people to help you, doing something different with your diet, sleep. I mean, all of those things impact us. And then when you have those hormonal changes and pregnancy on top of that, if you have a plan in place, then you know kind of what you're going to do, right? How it's going to, I mean, I think it's the same as any mental health issue or doing our own self-care, is that we need to have a plan of what we're going to do when these things come up, when these things start changing for us. I love that. I'm curious, as you were talking about, because I've worked so much with children, I mean, I've seen 2-year-olds on up. I have seen children who have in utero trauma, right? So say there was abuse or something like that, and how much that has impacted them and their brain. And you're talking about, like, even if a mom is depressed, that child may experience that depression before they're born, right? They may have that, some either physical changes or kind of, can you talk about that? Like what that looks like?
Well, if you're depressed and pregnant, you're probably already not feeling great because you're pregnant. We know women with depression are less likely to get to all of their prenatal care appointments. They're probably not eating as well as they would be. They're probably not exercising as well as they would be. They probably don't have as much social support because they might be isolating themselves. So like all of the symptoms of depression can play into it. The babies are more likely to have a low birth weight, to be born premature, which are ironically also some of the possible side effects from the medications. So it's kind of hard to know if it's because of the depression or is it because of the medication. There's just a lot of confounding
factors in there. Yeah. And I think it's just good to, like you're saying, like educate yourself and kind of look at, sounds like you make a plan with them of like the pros and cons, and is the mental health issue so intense that taking medication actually would be a benefit and be the best thing for this baby for the long run, for the mom and the baby, right? Because I think it's easy for women, I mean, from the time they have a baby until that baby's 50 to put that child ahead of themselves. And I think that's an important thing that I really focus on, is women's self-care, and that if your mental health is good, that's going to impact your child, right? If you're taking care of your own mental health, that's going to make a difference for your child. I think that's huge. I would love to kind of shift gears to talking a little bit more about what you're doing with, we talked about, like, menstruation and how that can affect our mood and our hormones. And then can you talk a little bit about perimenopause and kind of what you're seeing there with people's mental health?
Yeah, so perimenopause is actually the longest of the reproductive transitions. Some people, it lasts up to a decade. So perimenopause starts when you start noticing changes in your cycle. So sometimes they'll be heavier, longer, shorter, more close together, further apart. But these changes go on for a long time. So related to hormonal changes, a lot of women also experience hot flashes, night sweats, insomnia, changes in their mood. And there's also a lot of physical symptoms that are changing, like increased rates of osteoporosis and cardiac disease and central obesity. There's changes in your hair and skin. And it's also a difficult time of life because most people are the sandwich generation, maybe caring for their kids, also caring for their parents, a lot of like divorce during this period of time, career transitions, worried about finances and retirement. There's just a lot of things that come together in your late 40s that make it a really hard time for you to also be experiencing a lot of changes in your body and possibly changes in your mental health as well.
Yeah. So when people start seeing these things and kind of noticing it, that, I mean, I think of if you're not sleeping, that's going to affect your mental health, right? If you got insomnia, these hot flashes, changes in your body. What are you seeing as far as like, do you see PMDD, or is that separate from this? Like, what are you seeing with these women that are going through the perimenopause? What mental health things are you seeing with them?
It's mainly depression or anxiety, but also if they have like bipolar or schizophrenia, they can have an exacerbation. But interestingly, the reason I chose to talk about women and hormones is it's the same women. So it's the same women who have PMS, PMDD, are the same women who have mental health symptoms in pregnancy and postpartum, are the same women who have symptoms in perimenopause because of how their brain reacts to hormonal changes. So a lot of these women are the same women. So if I see someone who's pregnant or postpartum and having a mental health concern, I let them know that wouldn't it be uncommon for them to also have a mental health concern perimenopause when they're experiencing another big hormonal shift.
That makes a lot of sense. And I like you said, it can happen at any point in these different transitions. And I think that's a really good point for people to kind of recognize. Maybe they had their children and they experienced postpartum depression, and to know, okay, well, when I go through menopause, this may also be something that I need to be proactive about, because I may also experience those changes because of, I love that thinking about it's how my brain reacts to the changes in the hormones, right? I experience mental health symptoms because of these hormonal changes that are happening.
Yeah, and it's really distressing to the women who might have had very severe symptoms and then they recovered and they've had a great life and like been symptom free for maybe 10 or 20 years, and then they get the severe symptoms again, and it's just kind of like a in the gut, just like where I was before. And it's really unexpected, and a lot of people don't know about perimenopause or the impact that it can have on your mental health. So if you go see someone, they're like, oh, that's weird, like what else is happening in your life? And they don't think like, oh, maybe it is the hormones, like let's target that.
Yeah, I think that's so interesting, and it's maybe a little more validating for women to know that there's some changes that are happening here with my hormones that are changing my brain, right, or affecting my brain. Yeah, I think that's really, really important for women out there to recognize that some of these symptoms might be happening, due to these changes. So, what if someone has, anxiety or depression, and could it be, I mean, I guess everyone's different, that the hormonal changes don't impact the anxiety and depression? Maybe they've always had kind of anxiety or depression, or are you always seeing like that anxiety, depression intensifying as with, menopause or things like that?
No, it doesn't always intensify. I would say maybe in a third of people it gets worse.
Okay. And for some people, they have no symptoms at all of depression or anxiety, but then during those times, that's when they really start noticing it. Yeah. Cool. So what about menopause? When people actually are going through, we call it the change, right? That time of life where the body is changing so much, and kind of talk about that.
So it's very isolating, which is something that I didn't really understand until I went to a perimenopause support group. A lot of people don't talk about it. A lot of people don't know how their mom experienced it. So like we think about puberty, like a lot of people went with their moms to a maturation talk, and but people don't talk about perimenopause. Some people think of it as reverse puberty, which it kind of is. Like the hormonal changes that you went through in puberty are kind of being reversed. So it's a huge transition, and so many things are changing. Yeah, I just think that there could be a lot more education in this area.
Yeah, I think that's really important. So the women that, are going through this, and I don't know why some of these subjects are taboo, right, to talk about at the dinner table or whatever, but you're right. Like I remember my mom talking to me about when I'm going to have my period, and what you do, you go get your, your sanitary napkins and, all that stuff. But I don't even know when my mom went through menopause or if she's gone through it yet. So I think that's
a lot of stigma about postmenopausal women. They're portrayed as like not beautiful, or a lot of people say that it's kind of like the end of your life once you go through menopause. But there is specific reasons that people go through menopause. So interestingly, whales are the only other species that go through menopause, and whales live in matriarchal pods where the grandmother is in charge of like the whole pod of whales. And same within humans, like grandmothers, postmenopausal, perimenopausal, any age of grandmothers, they play such an important role in our society. And if women were able to reproduce till the day that they died in their 90s, hundreds, whatever, then their children and grandchildren would be competing with each other. But we don't want that competition. We want the grandma to be helping raise her grandchildren. Yeah, it's just kind of a beautiful thing, which a lot of people don't recognize, that there's a purpose for menopause.
We don't embrace that can be a beautiful time of life as well for women, after they no longer are in the childbearing years, or whatever you want to say that way. Yeah, that's really cool. That's interesting about whales. I didn't know that. They have that matriarchal, and I know that my grandmothers have played a huge role in my life, and I've really appreciated that. So, I think as you're talking about that, I think for women in general, there's so much emotion and sometimes angst around reproduction. Can you have children? Can you not? How many children are you going to have? And then there's the angst of, well, now I'm not having kids anymore, and where's my purpose in life? Because I thought my purpose was these children. Now they're older. Now I think there's a lot of like almost like psychological and mental changes too for people when they're going through this kind of we're always during life transition trying to figure out what gives us meaning, purpose, right? What makes life worth living, those kinds of things. And in our society, we tend to emphasize youth, right? And like what young people can do versus like the amazingness of the wisdom of those that are older. And, that every stage of life has its beauty and its difficulties, right? So yeah, I love that. Anything else you wanted to talk about? I mean, if you have a woman going through menopause that maybe is seeing more depression, like where do you start with her? What do you do there?
So there's some specific depression medications that have been tested in like perimenopause and menopause. So I usually try one of those. But yeah, that's another reason it's hard to treat women, is because most of the drug studies are done in men. Like, of course, they don't want to risk having a drug study on someone who becomes pregnant. So they just rule out a lot of reproductive age women in their drug trials. So that's another thing that makes it a little bit more difficult to treat women in reproductive transitions, because we don't have a lot of randomized controlled data.
Yeah, that's interesting. I think when you and I were at lunch, we were kind of talking about men versus women's mental health, right? And there's different aspects, and definitely this hormonal aspect has a huge impact on women's mental health, right? To recognize that, and that a lot of studies haven't been done on this. So you're kind of in a cutting edge field here of, seeing what affects women's mental health and that. Anything else that you want to share with us about what you've seen or how you help people?
I'll say something that's different about me than a lot of other providers is I do meet with patients for longer for their intake appointment. So I give patients about an hour of pre-work, and then I meet with them for 85 minutes or about an hour and a half. And about an hour is like the diagnostic exam and clarifying things. And then we do spend a half hour on treatment planning, and we talk about all areas like, how are you sleeping? How's your relationships? what are you doing for exercise? What have you eaten in the past 24 hours? How much water are you drinking? Like, what are you reading? Like, how are you stimulating your mind? I just try to be really comprehensive. And it also helps me differentiate. Like, a lot of people are misdiagnosed with bipolar disorder or a bunch of different things, especially if you only have 10 or 15 minutes to meet with someone in a primary care office to decide what medication to start. Like, that's not enough time to get a nice history. So
I love that, because I mean, I do the same thing with my first client. I just spend a lot of time because their first session, because human beings are complex, right? Biopsychosocial, there's so much going on. And I look at it like the wellness wheel: physical, mental, social, emotional, what's going on, financial. I mean, all of it's going to impact our physical and mental health, right? And I think that's really important to look at all those aspects of being a human being. We're going to take another quick break, but when we get back, I would love for you to share with us, I call it the words of wisdom, just a few tips that you would have for people who maybe are struggling with their mental health, are going through a life transition like menopause. Just a couple of things that you would give them as suggestions they can take home and try out.
Mindful health to help you flourish. What if in just 90 days you could completely change your life? If you could start losing the weight that's been weighing you down, get better sleep, eat better, have more energy, and have a healthy lifestyle for good. Have you ever wondered why changing your health is so hard? Do you want to believe it is possible? What you mentally focus on grows. This program is set up to help you grow a garden of health. In just 90 days, you can learn the habits of health. This is not a diet or a short-term health challenge, but a healthy lifestyle change for the long term. Health starts in your mind. Through this workbook and audios, you'll be guided and empowered with the confidence to see results and change your life. 30 days to plant the seeds of beliefs and mindset. 30 days to nourish the seeds through daily health habits. And 30 days to grow and thrive by gaining confidence and energy when you see the results of improved mood, weight release, and finding enjoyment in moving your body. Buy this program and watch yourself flourish. What you focus on grows. Let's grow a healthy body and mind. Reserve this program today by contacting Camille at flourishwellnessconsulting.com.
Welcome back, everybody, to Wellness Wisdom. We're having a great conversation today about some fun topics like menstruation and menopause and women's mental health, and how hormones definitely affect us. You know, that it does make a change in our mental health sometimes if our brains, the hormones change our brains. So, and that time of life can bring on the more anxiety and depression and things in those transitions. I have Dr. Allyce Jones with me. And Allyce, I asked you before the break if you would kind of just share with us a couple of tips, kind of words of wisdom that you would have for people when they may be struggling through a life transition with some anxiety or depression, or, some mental health issues.
I would say track your menstrual cycles. That way, at least there's data to back up, and we have a general idea of what's happening with them. 2 would be sleep. Sleep is so important. Like, imagine you're on vacation all alone with, partners, kids, animals. Like, how many hours of sleep will you be getting on the 4th night? Because probably the first night you might be crashing if you're delinquent on your sleep. But by the 4th night, you would be getting probably the amount of sleep that your body needs. So think of what that number would be, and then aim to get that number of sleep. Sleep is so important for your mental health. So I'd say tracking, sleep, and then seek out help. And if you're not happy with the help that you're getting, then seek out another provider. I think a lot of people, if they see one person and they don't like them, or they don't connect, they don't reach out to anyone else. But I would say keep trying. It's just like shoes. Like, I usually
What
don't
fits?
that I try on at the shoe store, but yeah.
I love that. So I always tell people to interview the people that are going to be working with them. They can interview 2 or 3 people if they want. So I love that, tracking what's going on. So you kind of know the patterns and things like that with your cycles. And then getting sleep, it's so huge, isn't it? I mean, I would say the majority of my clients, that is a struggle for them, is getting enough sleep. And it's a struggle for me sometimes. So, and then just seeking out help. And if people want to connect with you at Felicity, what's the best way for them to reach you?
They can call me 801-893-9564, or they can find me on Facebook or Instagram. It's at Felicity Women's Center.
It's FELICITY, right? Okay. And say your phone number one more time, a little slower.
Oh, yeah.
So we've got it.
801-893-9564.
Awesome. Thank you so much for being with us today. And I love this subject because, of course, that's a big part of what I do, is helping people with their mental health and self-care and just being able to have well-being in our lives, right? To feel happy, to feel good, and be able to meet the challenges that come up, which, life transitions like having children and going through menopause and all these things can impact that. So thank you so much for sharing your expertise with us today. And everybody, as you listen to this, I hope you can think of a couple of things that you could do that would just improve your mental health a bit and help you make peace with your body and like who you are. Take care, everybody.